what is the reality of healthcare scams? Why these healthcare scams are happening? And who is suffering from this kind of scams? What is the reason behind? And how you can solve this kind of healthcare scams? And how can you can safeguard yourself from this kind of healthcare scams? Let's talk about the reality of healthcare scam. If you are new to this channel, please subscribe to this channel. I share various tips, tutorials, ideas, strategies related to growing healthcare business ethically, clinical practice, how you can do ethical marketing and how ethically you can grow your healthcare businesses. So there are various news coming up and various cases are reported about different type of health scam. This some case happen in particular hospital, how doctors are looting and all those kind of some news are coming. So I wanted to put light on this uh, situation, why this kind of things are happening. So let's understand what is the reality of this kind of scandals or scams. So we need to first understand what is the healthcare scam. So these are basically fraudulent activities in the healthcare system, which include labs, diagnostic labs, hospitals, clinics, big corporate hospitals, all pharmaceuticals, all these kind of things are involved or said to be involved in this kind of scam. So it could be either the scam could be at the individual level, individual person doing this kind of scam, or it might be the organization itself, the whole hospital or the whole company is making some kind of fraudulent activity. So these are basically some unethical practices done by few people just to obtain some financial benefits. Uh, and they can extract that money from either the patient, from the government, from the insurance company. And they usually, this kind of scams are happening where they are charging very high, extraordinary high amount from the patient or stakeholders in the insurance company or the government itself. So we need to understand who is actually suffering from this kind of scam. Are the only patients they are suffering from the scam? No. Basically, the beneficiaries of the healthcare system, which includes the patients and their family members. And the major impact on them is they are getting the financial burden, and the more critical is the health risk that they are undergoing. Because this kind of scammer or fraudulent activity person, they try to not only just extract the money, but in most likely cases, they are some quacks also who are not qualified, even they have the so-called qualification, those qualifications are not authentic. Those are fraudulent uh, credentials that they are giving. So that's why this kind of frauds are risk for patients and their family members. And this risk does not stop to just the patient. It is impacting the healthcare provider, the, the healthcare provider who are working ethically. जो ईमानदारी से काम करते हैं, वो भी इसमें पिस जाते हैं. Because there is generalization happening from the news media, from the various NGOs and organizations, and even from the victim patients and their families. They start blaming all the doctors, all the hospitals, all the clinics, all the pharmacies, which is not the reality. There are very few limited number of people who are doing this kind of fraudulent activities, but because of this, other ethical doctors and organizations are getting suffered because of this. Because their reputation is at risk, and uh, because of this, the doctors are also not satisfied with their work because they also face this kind of blames from various people and they are not motivated to continue their work. So it's impacting not only the patient, but this kind of scams have indirect impact on the healthcare providers. So we need to ask why this kind of scams are happening. So the world suffers a lot, not because of the violence of bad people, but because of silence of the good people. So we need to understand जो victim है जो suffer कर रहे हैं, if they are not going to raise their voice against the fraudulent people uh, for any reason, then it's directly going to come back to those patients now or maybe in the future. So it's very necessary that everybody should be aware of what kind of scams are happening and they should be vigilant whenever they are interacting with any healthcare provider. So it's not just the doctors or the hospitals or the clinics or the pharmaceutical. There are many more people. So the patients and their family also have also responsibility for letting this kind of scam happen to them. There are various organizations, uh, government or private, which might be involved in this kind of uh, fraudulent activity. They might not be directly involved, but the lack of stronger rules, laws, or maybe even laws are available, but those laws are not getting implemented or executed properly. Because of that also, this kind of scams are happening. So it's not just the doctors or clinics or hospitals. There are many more stakeholders who are involved, right from patients and their family members who are responsible for letting this kind of scam happen. So how we can address this kind of scam? So there are various provisions by regulatory bodies. You can access to the government bodies or regulatory bodies and take support from them. You can make complaint or register to this kind of organization if you are experiencing any kind of fraudulent activity. Then uh, they can do the necessary regularly regular regulatory activity. Then the beneficiaries of healthcare system uh, as a as a beneficiaries of healthcare system, what you can do is that if you're watching this video, please share this video with your friends and family members so that you can create this awareness what kind of frauds are happening and how you can prevent or like, keep yourself safe from this kind of fraudulent activity. So share this video with your friends and family. If you have any ideas how this can be prevented, you can definitely comment those ideas in the comment section of this video. I will share your ideas in my next video and I will highlight your contribution. I will showcase your ideas. So please let me know the thoughts or ideas or strategies that you have to prevent this kind of fraudulent activity. Then, if you are a healthcare provider, what you can do is you can also highlight this kind of fraudulent activity to the relevant authorities and you can join this exclusive community of healthpreneurs where you will be getting various guidance and tips and tutorials to do and to do ethical marketing and how ethically you can grow your clinical practice or your healthcare business in a very moral manner. You don't need to do any fraudulent activity. So if you want to be part of this community, you can check the link mentioned in the description section of this video or the comment section. Also, you can apply the coupon code mentioned in the description box by which you will be able to access this community for free. To join this community, this is the exclusive community of ethical doctors. So be part of this community. If you have found this video useful, please share with this your family members and give a thumbs up to this video, like give a like, and you can share with your friends and family members. If you are not subscribed yet, please subscribe to this channel. Dr. Nitin signing out.